This is what Sam Webb calls rolling therapy. It's part of his mental health self-care routine.
My diagnosis is major depression with associated panic attacks and dissociative episodes.
When the former high-flying investment banker moved to Bathurst, just 3 hours west of Sydney, he knew there would be a wait to get to see a mental health specialist. But he was shocked by just how long it took.
It was nearly 10 months to get an initial appointment with a psychiatrist, and then you're on the books there, and it was over 4 months for a second appointment.
There was also a 3-month wait for a psychologist and 6 weeks just to see a GP.
There we go, mate.
Thank you very much.
He relied on his new social network for support, but the lack of professional help was devastating.
The absolute worst was preparing for suicide, and then a fully fledged suicide attempt.
The problem is a lack of health professionals in the bush. Alan Anderson has worked as a psychologist for 40 years, the last 15 in Kempsey on the mid-north coast of New South Wales. He's just turned 80 and wants to retire, but feels torn.
It's very difficult for me to walk away because there's a great need here and not many people to fill that need. So now, more to the point, how you've been going.
He's been trying to give away his busy practice for free, but can't find any takers.
Medicare for a generalist psychologist have a rebate of about $95. That's not enough for anyone to get by on. My running costs here are about $150 an hour.
Kempsey is one of the poorest regions in New South Wales. Few can afford to pay a gap fee. The local health service says rates of ADHD here are more than 2.5 times the national average, and rates of psychosis are almost triple. And it's not an isolated problem. The disparity in mental health services between the cities and the bush is clear. In metro areas, there are more than 500 Medicare subsidised mental health services for every 1,000 people. That number drops the further inland you get. The most remote parts of Australia have just 93 services for every 1,000. But the suicide rate is the highest in the most remote parts of the country. It's around double that of the cities. Groups representing psychologists have a simple answer.
We need to have the Medicare rebate for all psychology services to be raised to $150 per session for any patient or any client seeking support from a psychologist.
People are having to use a credit card instead of a Medicare card to pay to support their mental health, and it's just not acceptable.
Health Minister Mark Butler says the government has covered telehealth psychiatry appointments under Medicare and funded postgraduate placements for new psychologists. Is the difficulty in accessing care in regional Australia dangerous?
No, I don't think it's dangerous. I know it's bloody dangerous. It's costing the community, and it's costing individuals, and it's costing some individuals everything.
It is dangerous, yes. It's very unsafe for the community generally to have people here who need help, who want help, and it's just not available.
7 million Australians live outside the big cities, waiting for any signs of change.
And if you need information or support, you can contact Beyond Blue on 1300 22 46 36. Or if you or someone you know is experiencing distress, please contact Lifeline on 13 11 14.